I'm going to talk a little bit, and I think some people have heard me talk about this before, but it's always very useful to talk about organ donation in paediatrics. It is. I mean, anyone who discusses organ donation, it can be very emotive, and but it's getting it right and thinking about it in the right way that I want to talk to you about today. And Roger's one of our SNODs, which is specialist nurse in organ donation at Imperial, and so there may be a little bit of a double act, and also I quite like to, as you probably realise, I like to ask questions when I go along. And so if you want to ask anything, stop and ask during the talk, because I think you may forget things that you want to ask at the end, and we'd be very happy to take questions as we go along. So please ask questions. I think the first thing I want to say, and this paper's actually quite old now, from 2012, is that when you think about identification of a donor, it is actually part of the normal or the usual part of planning of end-of-life care. And it's something that you should consider. You've got to think about the best interest of the patient, and then there's quite a there's a lot of things to think about, including seeking consent and how you do go about seeking consent, and how you can do this with the appropriate approach, because we also know that where these things are not done well, somebody who may potentially be an organ donor or their family may be considering organ donation, it may be something that then doesn't get considered or gets refused. So it's really important to get these steps right.